Hello, Black New Mexico. Happy Memorial Day weekend and welcome to this pre-recording of Living While Black, Covid-19. My name is Jim Harvey and I am one of your facilitators for today's presentation. As always, we want to thank the New Mexico Office of African American Affairs and our esteemed Governor Michelle Lujan Grisham for making this presentation possible. Please note the comments and opinions of these presentations do not necessarily reflect those of the Office of African American Affairs or the government of the state of New Mexico. Today's program is pre-recorded and will be presented for rebroadcast beginning this Monday, May 25th on YouTube. We will return to our live broadcast on June 1st at 11 a.m. If you have questions or comments for today's show, however, you're invited to contact us at admin.oaa@state.nm.us. That's admin@OAAA@state.nm.us. We will read and respond to those questions at the top of our June 1st show. I'd also like to welcome my co-facilitators, Tanya Covington and Dr. Jamal Martin. They will join us at the end of our broadcast today. Before we get started, let me also introduce to you Sonia Smith, the esteemed Sonia Smith from the New Mexico State Department of Health, and she's got a few announcements that she'd like to share with us now. Sonia, welcome.
Well, thank you, Jim. My mom would be glad to know that I have made that status of being esteemed.
Absolutely.
On the Mooring Smith name. Thank you so very much. So yeah, just a couple of updates. We have some testing dates that are coming up on May 30th, Saturday, May 30th. We will be at New Hope Fellowship Baptist Church in Albuquerque. And then we will be down in Las Cruces on Sunday, May 31st at Second Bethel. Then we'll be back in Hobbs on Thursday, June 4th. And then we will be at the Mexican Consulate on June 5th and 6th. And I just want to remind everybody that the governor has said that masks are required when you are in public now. So if you need to have a mask, if you don't have a mask, I'm sure if you reach out to the Office of African American Affairs, they have some masks that they can get to you and other community leaders. And just wanted to also say that the governor has issued the reopening plan. That plan is about 50 or 60 pages, and it goes through all of the different industries and gives employers information on how they can work with their employees to keep them safe and be in compliance with the public order. That information is on her Facebook page, and I believe it's also on our Department of Health website. If you don't have that information, please reach out to the Office of African American Affairs and we can get it to you. So it's for individuals and employers. And lastly, DOH is working with the Office of African American Affairs and Dr. Martin on a survey so that we can get out to the residents across New Mexico, because it's important to know what's going on. If you've been tested, if you haven't been tested, those kinds of questions and what may be stopping you from being tested. So that will be forthcoming. So thank you so much, Jim. That's all I have right now. Thank you.
Sonia, thank you so much for that important information. Today's presentation is titled Pre-Existing Conditions, COVID-19. Our presenter is Dr. Lisa Taylor. Dr. Taylor is a transplant to New Mexico who was raised in San Diego as a proud Navy brat. She is a board-certified family nurse practitioner who currently works in endocrinology for Optum, New Mexico. Her passion is working in our community to prevent diabetes and other chronic diseases. She's also a strong advocate for people of color who live with diabetes, and her jam is helping people. I had to look at that when she said her jam. Her jam is helping people learn how to live with and manage diabetes. When her mom died from complications of diabetes over 10 years ago, she made it her mission while nursing school through pursuit of her doctorate to strive for culturally humble strategies for and care. She also serves on the American Diabetes Association's Community Leadership Board for New Mexico and Arizona, and is also a member of the American Diabetes Association's National Health Disparities Committee. That's a big one. Finally, she co-chairs the Diabetes Prevention Work Group for the Chronic Disease Council of New Mexico. Thank you and welcome, Dr. Lisa Taylor.
Thank you. It's an honor to be here. I'm excited. When Ms. Tanya said there's an opportunity for you to speak, I said I must take advantage of that. And if I can help people, even better. So if we want to begin the slides, please. So pre-existing conditions and COVID-19, lots to talk about. I'm going to try and be brief and also hopefully give you some helpful hints as we move through what this pandemic will mean in our own communities, in our homes, and in our lives. Next slide, please. I have nothing to disclose. Next slide. Because I am a healthcare provider, it's important that I set the parameters. The information shared during this presentation does not create or otherwise establish a provider-patient relationship between this clinician and anyone viewing this presentation. Specific questions regarding medications, treatment plans, or questions, concerns, or issues with your treatment plan should be directed to your healthcare provider. Next slide, please. So to give us some framework and some background, this is information from the Center for Disease Control. Approximately 6 in 10 adults in the United States live with chronic disease. And I deliberately chose this picture because it represents the breadth and the depth that is not only our country, but to a certain degree our state. And 4 in 10 adults live in the United States with 2 or more chronic diseases, which is the leading cause of death and disability in our country. Next slide, please. One of the things I wanted to make sure we use as a backdrop and as a framework for what we're going to talk about today is racism as a pre-existing condition. And I don't mean that in a pejorative sense. I don't mean that in a negative sense. But what we know is that there are public health experts who believe that structural inequity is a large contributor to health issues. And certainly as we're looking at how we grapple with living with certain conditions in light of a pandemic, it's not something that we can ignore. What we know is that workers in Black communities are less able to work from home. They're more likely to use public transportation. And these 2 factors add an increased risk of exposure to the coronavirus, which we know in turn, if you're living with chronic disease and you have increased risk of exposure, the sequelae of that or the outcome of that is that you may be more likely to be infected and thus be more impacted by that virus. The social determinants of health are conditions in the places where we work, live, play, pray, and where we grow, where we age. And this is according to Carter Edwards from the website noted here at the bottom. And I'm going to move the picture so I can see my slides. So all of these factors contribute to the cascading effect of why Blacks may have a greater propensity for the mortality and morbidity related to COVID-19. Next slide, please. So some of the things that we need to consider in order to prevent illness during the pandemic, and certainly as we move forward, this is a virus that is not going anywhere. So while we may see in the news and we may see in the reports from Governor Lujan Grisham that there are fewer cases of people being infected, or certainly fewer deaths, there are still things we need to follow and need to do as best we're able in our communities to reduce or minimize the likelihood that someone would become infected. So some of the things that we need to think about, isolate yourself at home, If possible, social distancing is able. This is particularly true if you have been tested for COVID-19 and you have tested positive for COVID-19, but your symptoms are not sufficient that you need to be hospitalized. You need to make sure that you're staying in your home and minimizing your risk of exposure to other people. Wear your mask, as Ms. Sonia said earlier, wear your mask outside of your home. Wash your hands frequently for at least 20 seconds. I tell folks, if you have a favorite little song like Happy Birthday or something along those lines and you sing it at least twice, that covers your 20 seconds and says you've washed your hands long enough. Whenever possible, avoid touching your face, eyes, nose, and mouth with your unwashed hands. When you're wearing your mask, it is always, if possible, you will gel up, remove the mask, and then wash your hands, particularly if you've been out shopping or doing other things where you don't really know if other people are washing their hands. You don't really know if other people are taking care to sanitize, so you always want to do the best you can for yourself. Also, if you're not able to safely be in a grocery store or safely be in a setting to obtain food and other necessary supplies, there are community resources for food delivery. There are senior hours in many of our local grocery stores. And the idea is to try and find time when the businesses will be less crowded, because that better allows you to practice social distancing and thus reduce your risk of infection. Next slide, please. So one of the things I want to use as an umbrella is cardiovascular disease. When we're talking about pre-existing conditions, there's a host of things that we could talk about. Because as I said earlier, I'm going to try not to bore people to death and turn this into a lecture. So I'm going to look specifically at cardiovascular disease, which is an umbrella of various disease states affecting the entire body. So some of those include hypertension or high blood pressure, as we commonly call it, diabetes, hyperlipidemia, which is high cholesterol, high LDL triglycerides, also obesity. One of the things that I'll say several times is knowledge is power. Knowing your numbers gives you more insight in terms of what's going on with your health. It gives you insight in terms of how well the plan that you and your care team have created is affecting these pre-existing conditions. So some of the things you always want to know, particularly if you live with pre-diabetes or diabetes, is your hemoglobin A1C, which is a 3-month average of your blood sugars. You want to know your blood pressure. And if you live with high blood pressure and do not have a blood pressure cuff at home, most insurance companies will cover a blood pressure cuff. You merely need to get a prescription from your primary care provider. And we also want you to know your cholesterol numbers, because diabetes in and of itself is a cardiovascular disease. High blood pressure is a cardiovascular disease. So overall, you need to know all of your numbers to better reduce your risk of heart attack and or your risk of stroke. Next slide, please. So this is, for those of you who are already in healthcare, I mean no disrespect, but I figured this is a broad audience of people who may be participating with the podcast. So I wanted to make sure we're all using the same terms and coming from the same framework. So high blood pressure in and of itself is when your heart beats, it pumps blood throughout your body. And this creates pressure against the blood vessels. This, as you think about what is blood pressure and then what is high blood pressure, everyone has blood pressure. If you don't have blood pressure, you're dead. The systolic is when your heart pumps the hardest through the arteries. That's the upper number of your blood pressure. And the diastolic is when the blood is flowing back through the veins, back to the heart for oxygenation. So that's the lower number. The goal for most healthy adults is 120/80. However, because there are a lot of different factors going on in our community and other communities, including age, other disease states, there's a lot of different factors going on, that may or may not be the goal that your team has set for you. So I don't want you to leave here thinking you have to have a blood pressure of 120/80 or there's something wrong, because again, it's a variable number based on a lot of different factors that you'll determine with your team. One of the things that jumped out at me that's rather frightening is that nearly 50% of all adults in the United States have high blood pressure, and nearly 46% of that 50% are not meeting their blood pressure goals. That could be because they don't know that they have high blood pressure. That could be that they need medication adjustments. One of the things I have a regular conversation with my patients is the affordability of your medications. And sometimes people, if they're not able to afford the medication, will stop taking it or they'll ration it. And when you're doing that, it's not allowing the medication to work as effectively as it could. And not being able to afford medications is real. So it's an opportunity to have a conversation with your care team. Is there a less expensive option that you can use? Is it less expensive if you use mail order versus purchasing it every 30 days at your brick and mortar pharmacy? So it's an opportunity, again, to make sure you're getting the very best care for yourself, because you matter and your health is important. Next slide, please. So some strategies to manage high blood pressure at home. And this is a little small, but I think the slide will be available, the slide deck will be available later if you want to have it in a print version. So as I said earlier, if you live with high blood pressure, it's really important that you have your own blood pressure cuff at home. There are a lot of varieties. There's the kind you can put on the wrist. There's the kind where you use a stethoscope and you put the pressure on to occlude your blood pressure, and you can read it for yourself. There's a lot of different options. What's most important is that you find something that you can operate on your own, or a spouse or a loved one in your home can operate, because knowledge is power. And if you're starting to see, this is where my blood pressure should be, and it's either higher or lower, that is a sign and an opportunity to have a conversation with your care team. It's important that if you've been directed by your care team to take your blood pressure, it's important that you check it at different times, because our blood pressure is variable based on our circadian rhythms. So sometimes it's going to be higher, sometimes it's going to be lower. So vary when you check it. Some people want to check at the same time every day, and if that's what helps you remember, nothing wrong with that. But periodically check, maybe in the middle of the day, maybe check after dinner, check at bedtime. It gives you a broader picture of what's going on with your blood pressure. Food. Food is love. Food is life. When I think about food, I immediately picture my mom's apple pie, and she spoiled me. I can't eat anyone else's apple pie. So what we need to think about as a community is, when we eat, are there ways we can eat the foods that we love that have less salt or sodium? So when you're in the store shopping and you're looking at the labels and you're looking at some of the, for example, people try and eat healthy and they'll do like lean cuisine, or they'll do Weight Watchers meals. And when you look at the salt content in one of those meals, it's staggering. Typically, people want to aim for a total intake of less than 2,200 milligrams of salt or sodium. Again, that's individualized with your team. So you really think about salt as like your bank account. There's your top number. That's what you shouldn't go over for the course of the day. So if you're monitoring your labels and you're monitoring your intake, if you're salting your food and salting things as you're cooking, when you've hit that number, you're done for the day, because we really want to make sure you're not eating more than the body can process. It's also really a good idea, not just because of blood pressure, but it also reduces your stress, is to walk, particularly if you walk after meals. It drives your blood sugars down, it lowers your blood pressure, it's a great way to be out and about. Again, if you're in community and there are a lot of people around, you do the best you can to practice social distancing. You wear your mask, but walking is free, and it's a great way to reduce your blood pressure. All you need is a pair of shoes and a place to go. If it's not safe for you to be outside in your neighborhood, and there's a variety of reasons that could be, then you can take loops around your house. You can take loops around your yard. If you have stairs, you can walk up and down the stairs of your home. Walking is just the best way to stay healthier. Next slide, please. Diabetes is something that is rampant in our country. We as a Black community are at high risk for diabetes. So I want to break down some of the components of this disease and some of the things to watch for so that you can better manage your diabetes, particularly if you're not able to get in to see your team, or maybe you're scheduled for a telephone visit or a video visit, but it's several days or several weeks down the road. I want to give you a framework of some things you can do to manage diabetes. Next slide, please. So to give you some statistics, more than 30 million people in the United States have diabetes, and 1 in 4 don't know that they have it. And as I said earlier, knowledge is power. So it's really important, again, to know what's going on with your body, what's going on with your health, because you can't manage what you don't know. More than 84 million US adults, that's approximately 1 in 3, have prediabetes. And 90% of those 84 million have no idea that they have it. So again, there's a lot of factors to why that is. I'm not naive enough to think people just blissfully go around the world and have no idea and don't care about their health. There's a lot of factors in terms of why people may not know. So hopefully one of the takeaways from the presentation today is, if you have to, you print this out and you take it to your provider and say, I need to know. I need to know my blood pressure, I need to know my A1C, and I need to know my cholesterol numbers, because I am important and my health matters. A person living with prediabetes is at a risk of developing type 2 diabetes, as well as heart disease and or stroke. And diabetes increases your risk of heart disease and stroke because it is also a cardiovascular disease. And if not managed, and you'll notice I never use the word control. We can control a lot of things in our world, what we wear, what side of the bed we sleep on, what kind of car we drive. It's almost impossible for someone to control blood sugars. So the goal is always to manage blood sugars as you're able. And if not managed, it can lead to other complications such as kidney failure. We all probably know someone who is on dialysis or is close to being on dialysis. The number one reason for that is diabetes. Not managing blood sugars can lead to blindness and amputation of a toe, foot, or leg. Next slide, please. So diabetes in you. I'm going to say it again. Know your A1C. Know your blood sugar goals. Again, that's something you determine with your team. When I talk with my patients at the end of every visit, I say, okay, let's recap. What's your A1C now? What's the goal we're aiming for? How are we going to get there? We're going to get there by knowing what your blood sugar goals should be and how we're going to get you there. What we know in terms of our body is that hyperglycemia, or high sugars, make it really hard for the body to fight infection. And again, if we're talking about somebody who lives with chronic disease and they're at risk for COVID, or they are infected with COVID, it makes it that much harder for the body to do what it needs to do. And always take your medications as advised by your healthcare provider. But again, take an opportunity to talk with them honestly and openly if those medications are not affordable to you. Because as I say every day, those medications that you can't afford and don't take are not going to help you do what they need to do. So there's always some room for finding medications that are more affordable. Next slide, please. And some of the things that can affect your blood sugars. Stress and blood sugars are not besties. And what we know is we're living in the middle of a pandemic. So the stress is kind of something that people are dealing with as much as they breathe air. So some of the things, there are 42 different things that can affect your blood sugars. Some of those include stress, cortisol, which is produced by the little organs that sit on top of our kidneys. Are called our adrenal glands, insulin resistance, and pain. And when we're talking about people who live with diabetes and they're stressed, that increases your insulin resistance, which means your body, again, is not going to work as effectively as it could. If you have pain, whether that's acute pain because you had an injury or chronic pain, those things all affect your blood sugars. And again, at the end of the day, our goal is to manage blood sugars so we can maximize how your body works. Next slide, please. Really important things to consider if you are somebody who lives with diabetes. If you have a sick day, which could be a cold, it could be the flu, it could be COVID-19, it could be an infection, those things that are going to keep you in your home, you need to make sure you have all the tools to better help manage your blood sugars. So always ensure that you have enough supplies, test strips, lancets, sensors if you use the Freestyle Libre CGM, syringes if you use medications where you have to use a vial and a syringe. Ketone test strips are really important if you live with type 1. You can become very dehydrated and have very high blood sugars, which sets off a cascade of things in the body. So you want to make sure that you're monitoring your ketones. Always ensure that you have plenty of medication. That includes insulin, any oral medications that you're taking, any other injectable medications. When people are living with diabetes, whether it's type 1 or type 2, there's a laundry list of medications. We always want to make sure you have enough. If there's a hiccup at the pharmacy or there's a hiccup with your mail order, you don't want to be without those medications, because having blood sugars that are too high could land you in the emergency room or in the hospital. And we really don't want people to be in the hospital unless they absolutely have to be there. That's for really sick people. If you're experiencing this sickness and perhaps you're not drinking or eating as much as you normally do, you want to make sure that you have some clear fluids, again, to give your body some energy. So those can be sugar-free and also with carbohydrates or sugar, because depending on what's going on, you may need more sugar to help your body do what it needs to do. Determine with your provider how often to test and how to adjust your medications if you are sick. That will differ if it's an illness that's short-term versus something more long-term. So this is not the sort of thing you want to try and manage on your own. You always want to have a written plan. And if there's any possibility that you're just not sure what you need to do, you always want to reach out to your team. I, as a provider in endocrinology, we're on call every day. So after our office closes, if my patients have a question or concern that they didn't remember during the day, they can contact me on call after hours. Because again, it's a team effort. It's not just the provider who's in charge, it's you and the provider. You're a team, and together you're going to figure out how to manage this. Next slide, please. And when to seek emergency care is critical. And that may mean starting with calling urgent care. In some care plans, they want you to contact your triage nurse or urgent care to see if there are things that you can do at home or if you need to come in. But things that you do not want to ignore: vomiting and diarrhea that does not resolve over 3 to 4 days, diabetic ketoacidosis, which is a very high blood sugar. Those symptoms can include you're very thirsty, maybe you have a fruity smell to the breath, and it's a very obvious fruity smell. You're peeing more than you normally would. Perhaps there's stomach pain, and that can be diffuse, meaning your whole abdomen. It can be confined to one part of your body. Nausea, vomiting, certainly loss of consciousness, and particularly if that loss of consciousness is due to low blood sugars. You need to have a way to be able to treat that. Your family or your friends have to have a way to treat that, and you have to call 911. If you're feeling more drowsy than usual, and not just kind of tired, but drowsy such that you can't do your normal activities, it's difficult for you to get out of bed and be active, that's a sign that there's probably something going on. And what we call Kussmaul breathing, or really deep breathing. So any and all of those, if you're not sure, again, reach out to your team and just check in with them. Is this something where I need to come in and be seen, or what can I do to manage it at home? Next slide, please. Again, talking about cardiovascular disease, I mentioned earlier, and Miss Tanya said, know your ABCs, right? That's your A1C, your blood pressure, and your cholesterol. So the umbrella of cholesterol includes total cholesterol, which is your low density lipids and your high density lipids. Again, know your goals. Being above your goals increases your risk for heart attack and or a stroke. And also having blood pressure above the goal increases your risk for heart attack and stroke. They all go together. So it's really important to know your numbers and work with your team. Next slide, please. And I would be remiss if I didn't talk about obesity. This is affecting now in our country, not only adults, but also we're beginning to see obesity and diabetes in children. So if the trends continue as we see them now, almost 4 in 10 adults will be obese by 2035. That's a short 15 years from now. As you look at this slide, we break it up between 2015, which is only 5 years ago, and 2035, which is only 15 years from now. So in 2015, around 3 in 10 adults were obese. And again, if our trends continue, approximately 4 in 10 adults will be obese. And what we know is we pass along to our children not just our genes, we also pass along behaviors. So it's really important as a family that you look at how can we eat the best foods we can afford or grow the best foods we can afford. How can we be more active as a family? Because what we know is for anyone who lives with obesity, it affects not only your life now, but it shortens your lifespan. And for those of you out there who are grandparents, perhaps great-grandparents, aunties, great-aunties, uncles, great-uncles, you want to make sure you're here to be healthy and to be able to spend as much time with your family as possible. So I've got some things we can talk about in just a moment. Next slide, please. We're going to talk a little bit about being physically active. Okay, next slide, please. So I want to leave you with some strategies to move more and also reduce your stress. So your goal, aim to move at least 30 minutes most days of the week. And moving does not mean power shopping on Amazon. Moving more does not mean trying to, outrun the ice cream truck. Although if you're running and you don't catch it, you're still getting exercise, so that counts. But that activity can include things like yoga, meditation. I talked earlier about walking, strength training. There are a ton of free resources out there online. So if you're in your home and you can't do your usual silver sneakers, or you can't get to the gym or the pool, there are things you can do in your home. I work with a trainer several days a week. He sends me my routine by text, and my detergent jug and I have become besties. There's a lot of things you can do with those really heavy detergent jugs or bleach jugs, or if there's still nothing in it, then you save the cap and fill it with water or fill it with sand. There's a lot of things you can use in your home. The thing you want to make sure you're doing is moving more than you sit. When we sit for extended periods of time, that increases our insulin resistance. And again, our body is not better able to use our food for fuel. So we want to be moving as best we're able. And this young man here in the picture, I mean, he's probably a yoga instructor. We don't all have to look like that. We do the best we can. You just want to literally keep it moving. Next slide, please. And some strategies around nutrition for healthier living. So there is a ton of research to support a plant-based diet may reduce or reverse the effects of hypertension and cardiovascular disease. And one example, there's a free documentary available on Netflix called Forks Over Knives. It's based on a book that was written by a cardiologist and a psychologist. And there's a lot of really good strategies in there. I appreciate myself included, I am an omnivore. So I do like my lean animal protein, but I do try and have at least one plant-based meal a week as a strategy to not only challenge my brain and challenge my body, but just cook some different things. Where possible, we want you to choose whole foods, whether those are fresh, frozen, or canned. Again, it depends on what you have access to and what works for your budget and what works for your lifestyle. I will say when you're looking at foods that are canned, it's a good idea, if possible, to rinse them because they often have either more sugar with fruit and they have more salt if it's vegetable. Again, monitor your salt intake. As I said earlier, you want to think of your total amount of salt as like your bank account. So when you reach that number, you're done. If you can stay under, bonus. And read your food labels, particularly for salt, sodium, basically the same thing, and carbohydrates, starches, or sugars. I tell people, don't get too hung up on the label. What you want to think about is this something that my body needs, or is this something that I want? Because giving your body more of what it needs allows it to work so much more efficiently and helps you better manage if you are living with chronic disease. Next slide, please. Next steps. As we know, this virus is not going anywhere. It is not like the flu. We do not yet have a vaccine. We don't know the trajectory of where this is going to go as a state, as a country. So I wanted to leave you with just some strategies to help moving forward. Again, work closely with your primary care provider and your team to develop goals and plans based on what chronic conditions you may live with, and also as a strategy to prevent other chronic diseases. Schedule a video or telephone visit. For example, in our organization, as I said, as Mr. Jim said earlier, I work for Optum, and we're offering curbside video visits with iPads. We've even piloted some visits where the iPad will go to the person's home if they're not able to get out and have the visit and they don't have the technology to be able to complete. So it's a good conversation to have with your team and with your insurance about, so what are my options for having a visit with my provider that I don't have to leave my home? Advocacy, as Ms. Sonia said at the beginning, there's a variety of sites around the state where they're offering free testing, particularly for African Americans. So if you haven't been tested, if you're afraid to be tested because you're concerned, what if it's positive? What will that mean in terms of me being able to go back to my job or do what I need to do? There is a lot of resources out there, and I'm gonna encourage people to start with the Office of African American Affairs because they're dialed in to all different kinds of resources across the state, not just here in Albuquerque. Vote, vote, vote. I'm not gonna get political beyond vote and fill out your census. You've seen ads all over TV, radio. It's really important. We're already a state that's kind of behind the 8 ball when it comes to resources. We want to get every dime that is coming to us. Part of that is based on how you vote, and part of that is making sure, if you're eligible, that you complete the 2020 census. Next slide. I think I'm almost at the end here. Yes. That's all I have. This is my email here at the bottom. As I said at the beginning, I cannot take the place of your healthcare provider or your healthcare team, but perhaps you have a general question. Perhaps watching this has sparked a general question, or how would I have the conversation with my provider about fill in the blank? I'm happy to have you send me an email and we can troubleshoot that. As Mr. Jim said in my introduction, my jam is making sure my community is the healthiest we can be, because if you don't have your health, what do you have? Thank you so much for your time today.
Thank you so much, Dr. Taylor. We really appreciate all that good information.
My pleasure.
Again, we want to thank everybody for joining us on the podcast. We hope that you've been enjoying these past Monday podcasts. We want to let you know what's coming up ahead. June the 1st, we're going to have Tammy Watson from the Office of African American Affairs, who's going to be talking about masks, how to make them, where to get them, how to wear them, all sorts of things. And anybody who's interested in helping out with making masks for your community, we're hoping to get a number of people around the state who are willing to do that, and the NAACP has said that they would help us get them distributed. So please make sure that you watch for that on June the 1st. Then on June the 8th, we are going to have our own Director Harvey, who's going to be talking about interpersonal violence now, and what that's like under the current conditions. Then on June the 15th, we are going to be talking about the education of our kids, what's going on when now that school was relaxed and then it was out and then they're not sure when it's going to start up. what to do if you have kids who are trying to get into college. We're going to have an educational expert who's going to talk to us about that, and that is Viola Cox-Henry. So I just want to say also, if you have been enjoying these, please let the Office of African American Affairs know. They are footing the bill for all of this and coordinating it. So please let them know if you'd like to see it continue. And please also let as many Black people as you know around the state know about these Monday morning podcasts. Thank you again for joining us, and we're going to go back to Director Harvey. You're on mute.
There I go. Thank you, Tanya Covington, the incredible Tanya Covington, for those important pieces of information. Let's go on now, because I think a good wrap-up would be to go to our resident guru. This man is probably one of the most informed and most engaged health professionals and health educators in all of New Mexico, if not around the country. So I'm pleased to hand it over at this point to Dr. Jamal Martin.
Thank you very much. Thank you, Tanya. Thank you, Sonia. Thanks, everyone. Dr. Taylor, thank you very much for your informed opinions on the beauty and treasures that our nurses have given our community for a very long time. You know, when you think about this issue of pandemics and our responses to pandemics from 1793 on through 1919, it was Black nurses who served the community very well and admirably and set the tone for so many important ventures. So I want to thank you for sharing your expertise and wisdom with us and with this community. And I think it was very, very basic, good, solid, useful information that you provided to the population about coexisting conditions and how to better manage them in ways so that if they have the misfortune of being exposed to SARS 2.0, that we can hopefully mitigate those circumstances much easier. And so, and there's so much to do and so much to tell, and we hope that you'll come back with us and share some more knowledge with us. And I'm curious, and I'd like to hear you some other time when we have more time to talk about the issue of medical mistrust in the community as we go through these issues. You know, the information that you were providing in terms of health promotion, disease prevention, and education is very solid, but somehow our communities are still reluctant to do that for a number of different reasons, which just compound it and add to this notion of syndemics and comorbidities and what have you. So, you know, and maybe at some time we need to talk about this in terms of will people be, if this is going to be endemic for a long time. There's no denying all that, because we failed in this country to really sort of get a handle on this from the very beginning. But I'm wondering right now how many African Americans will really respond to telehealth and other types of issues, you know, as we move forward with this. But that's another story, another discussion, and maybe throughout these conversations we can help sort of prompt people and help them get over some of those other anxieties and things. So I really don't have any other very specific questions right now. There's so much more to cover with this, and I'm going to pass the mic back over to my other colleagues and see if they have some things to say, and maybe I will have something else to think about. I'm kind of worn out from a large presentation I gave this morning on resisting pathologies of power and place by meeting progressive obligations for health equity, where I covered immunizations and everything. So I'm sort of talked out right now. But bravissimo. I salute you folks. I salute the work that you're doing for the community. And I support the Office of African Affairs and its staff for continuing to work with us on this endeavor. And we hope that we will reach enough people to take this to the next levels in the future. And I want to thank my sister from the Department of Health again, Sonia Smith, for advising us about the next 4 opportunities that we're going to have to do screening and testing. I had the feeling for some reason or other we were going to be doing it this on the 23rd is Saturday. And I thought, oh, shucks, I'm tired of I can't be there. But now that it's the 30th, I'm like, oh, okay, I can be there to help out and support. So again, I'm looking forward to future dialogues and sharing. We're going to keep on keeping on, and we're going to keep doing it till we can't do it no more. Plain and simple. Because I like one of the things you said in your slide earlier about racism being a pre-existing condition. And I would just go ahead and just take it one further and say it's not just racism, but it's white supremacy. That's a pre-existing condition for most of us and for the nation and the world. And so we have to figure out how to deconstruct that institutionally as in other ways as well. So be good, be safe, be in health, and health, peace, prosperity, and good life. Thank you.
And remember that any past podcasts that you've missed, you can tune into them on the Office of African American Affairs YouTube channel. So they are available. And again, we hope we'll see you continuing.
So this concludes our presentation for this week. Dr. Martin, bravo, and thank you again. Sonia Smith, thank you. Tanya Covington, thank you. And Dr. Lisa Taylor, many thanks to you as well. We hope that you all will come back and join us again on June 1st when we will resume our live broadcast on Mondays at 11 o'clock a.m. In the meantime, be well, stay safe, and keep others safe as well. Happy weekend, happy holiday weekend to you. Bye-bye.
I have my